it was
How long it's been?
honest. I don't remember. It's been over a year.
Yeah, it's been over a year. Brittany and her sister took my course. Okay, so I just want to kind of open up the floor. Everybody is different. It's something that I've been doing on this is our last Thursday. So our 3 weeks have already went by. Everything that we do is very similar to what y'all did. I did revamp a whole lot of stuff. They have textbooks. I give my own quizzes, just to kind of help everyone lead on. So I just kind of want you to tell them, how did you feel about me, first off, the teaching the course? How did you feel I was as an instructor? How did you feel about the exam? And what do you do on your job now?
Okay, so Miss Manetta, she's a great teacher. She's one of the best teachers I've had in my entire life. She was patient with me. She helped me understand because I can read something, but I'm not. I might not understand it. Like I'm like a hands-on person. Like let's talk about it type of person. And her course, it was really easy going. She taught me a lot more than I ever known about phlebotomy because I've always wanted to do it, but I never took the step to do it because I probably was telling myself for like 2, 3 years, I'm gonna go take the class. I just gotta find out where to go. I'm gonna go take the class. Then I found places that I could go, but I was like, I don't know. I don't know about these people. Like I've heard bad things, I've heard good things. And so when my stepmother told me about Miss Vanetta's class, and then she was like, she's a good teacher. I'm glad my stepmom, brought it to my attention and put us in your class as well because it was nothing but a blessing, truly. So the class, it was very enjoyable. Like I said, I learned a lot. And Miss Vanetta, like, you really taught me a lot because I'd be at my job, they'd be like, oh, yeah. I'd be like, yeah, like, this is like this is like that. They'd be like, oh, I didn't know. They'd be like, yeah, my teacher taught me that. So, I get to brag a little bit, you
Yeah.
know. But,
So what do you do on your job? First off, where do you work and what is your position there?
so I work at a plasma center. It's called Parachute. I work in Bay City, and I'm a phlebotomist. And we stick people just one time if they need a restick. They only have to do a restick. So working at a plasma center is kind of it's not hard, but it's like a lot to deal with because when they donate plasma, somebody can end up having a DAR. They can start sweating. They can get dizzy. Sometimes I hear people say that their ears are popping, they can't hear. I've seen people have heart attacks right in front of me, like full blown heart attacks. Like it's pretty scary because
Mm.
whenever you donate plasma, your blood, the machine draws up to about 280 milliliters of blood, and then the plasma starts dropping outside of your blood cells. So whenever, like, most people, they're not used to it. Some people, their body's used to it. And this lady that I remember one, she was coming to donate plasma before I even started working at the center. So I remember her heart attack the most because I was cracking ice packs and put them on her because she was feeling hot and stuff. So she just was like bottom down in her feet and stuff. And of course, I called the nurse so they could come, do their job because at that point it was out of my hands. I'm just a phlebotomist, so I don't know what more to do. So, like I said, working at a plasma center, you learn a lot, you see a lot. And when I first started, I was nervous, of course. Like this is my first phlebotomy job ever. Um, didn't really know how to stick because when we practice in class, we really just use the hands. So working in the antecubital area, I mean, I was familiar with it, but it was kind of like my hand was a little bit shaky. And I've been doing this since November um, last year, and I have quite a few donors that'll come in and ask if I can stick them because they like the way I stick. I don't. They when I stick them, they be like, "You're good. I didn't feel that. Is the needle in already?" I be like, "Yeah, like it's already in your arm." They're like, "Man, you're good. Like you're so easy going. Like I love when you stick me." And I'm like, "Well,
So
I just go straight in. I don't do any. angles or, I don't go under the vein. I go straight in the vein.
How
When
long?
you first went to the
So
job? Oh.
How long did they
what was
train?
that?
How long did they train you before you were on your own?
2 weeks. I actually, when I started, I had one coworker tell me that I'm not going to be good at my job. It's going to take me about a month to, finish everything, get everything down. And of course, I proved it wrong because it took me 2 weeks to finish everything. Because first, you have to do, first things you learn is donor disconnection. That's pulling the needle out their arm. Then I had to learn station installation. That's set up the machine. And then the third and fourth thing I was hands on with was the Benny punctures and then receipts. And so I finished all of that within 2 weeks because I'm a let's keep going person. Like I'm trying to get this done so that way I can learn more. And so it's pretty easy now. Like, I mean, the lady that trained me, I move faster than her now, which I kind of feel is crazy.
I know that's right, Brittany. I told you.
I don't know how I move faster than you, and you're the one that trained me. She's worked for the company for 2 years now. So I'm like, it's crazy. And I just be looking like, I be done stuck about 3, 4 people. She's still on her first person. And I go around her, like, these people, everybody don't got a lot of time in the day. Some people come and donate on lunch breaks. They got to get back to work. So I stick and move. I get out the way, disconnect, and they're going out the door. They get paid. It is, that's how it is. I really love my job.
Yes.
I love the donors. I talk to them like I know them. They tell me their problems, stuff like that. Like they're just comfortable with me. I don't know why. I guess because I'm goofy and just easygoing. But I love my job. It's a good experience. I don't know if I would ever leave this place because I really love my job.
Were you nervous on your first?
What was that?
Were you nervous on your first stick?
Oh yeah, I was, and my hand was shaking. The down like whenever we first start, they try to find somebody with like big veins, big juicy veins, where like you can see it without even putting their cuff on. So the first stick, I remember like it was yesterday. I stuck the man. He had a big old vein, like you can just see it, like it was big right there. Like if you miss it, something wrong. So I stuck him, but when I stuck him, my hand was shaking like somebody was out to get me, like shaking like real bad. So when I stuck him, I went straight in the vein, but I didn't go in far enough. And that was another thing I had to learn was like you got to go in just a little further. Like I used to always tell, like I would stick somebody and I wouldn't get the flash. Now I call one of my coworkers to come help. They be like, you got to learn to go just in just a little further. Don't be scared. And I would always be scared because I'm like, I'm new to this. Like, I don't know about going in too far because, we use a 17 gauge needle. Them not no little needles. They're pretty big. So just being me, the needles that practice with in class on my D's is two whole different sizes. Like, so I was a little nervous at first, but now like the more the people come donate, they get scar tissue. So I know whenever they have scar tissue, you got to go in further because the scar tissue really sits up more closer at the front of the venipuncture. So you have to go in just a little further. So that way you don't have to go back and like adjust their needle or anything like that. And then once you go in, should be good. But if they have scar tissue, make sure you get a real good feeling of that. Because when I first started, my trainer didn't teach me about scar tissue. I really learned it on my own. And whenever I turn a cuff on, I get a real good feeling because sometimes you might think scar tissue is the vein, but it's not the vein. The vein might be a little further back. The scar tissue just builds up at the front, and it can get so thick to where like you'll think, okay, boom, I don't even got to check and see if it's a vein. Like, no, you still need to check because that scar tissue in the vein. It's a little tricky.
Was you nervous when you first seen somebody pass out?
Oh yes, I ain't know what to do. I started to cry.
What procedures did you take?
Well, as soon as they passed out,
Being
like
nervous.
she was already, the lady had already like passed out. Like I said, I was gonna put the ice packs on her, and she just like started like shaking, and I was like, I started calling the nurse. I was screaming, "Scary, scary!" and she hurried up and ran and came, and like the lady literally passed out. But the nurse is so good at what she does. She like rubbed on one spot of her chest, and she woke her back up, and she started doing her vitals and everything. And anytime somebody passes out, we have to call EMS. The EMS came and they checked her out and all that. But from my understanding, it's like, say like today somebody threw up on the donor floor while they were donating. We have to call the phys sub. They have to come and check their vitals. And the reason why the guy threw up was because his blood pressure was high. If your blood pressure is high, it's not okay for you to donate. So whenever they get screened in the front, they have one chance to retake their blood pressure. If it doesn't go down, they cannot donate. It cannot be over 100. It can be right at 99. It can't be 100 or above. So the guy, I don't know, I guess somebody had texted him or something. He got mad while he was donating. And he was like, I feel like I'm going to throw up. And I could see, like, he was looking pale and everything. Like, his whole face had turned, like, blue. His lips were blue. So he had finished, like, his full donation, which is a good thing. And he started receiving his saline. And then he received the rest of his blood back. And, he was fine after he left. But the nurse, she still came and ran his vitals and everything. Like, they have to do what their job to. They have to check them out, make sure that their vitals and heart rate and everything else is good.
Okay, Brittany, I am so happy. Oh my God. You remember how you were at the beginning? You blossomed into a great flower, as everybody does. Do y'all have any other questions for Brittany?
Did you get the practice exam book before you took your test, or did you go with the knowledge Miss Juanetta provided you with?
I went with the knowledge that she provided me with. I didn't get the book.
Was it hard?
Yes, but no. Like, when I took the test, I read the question about 50 times to make sure I understood the question. Because, sometimes the question might be asking the same thing you think you just answered. So I'll sit there and read and sit there and think on it before, just click an answer. And then, like, I wanted to be sure of myself and the answer that I was choosing.
Okay.
Brittany, oh my God.
Um,
And you drove from far to take my class, right? And I know we're a little bit past time, but real quickly, you told me that your job sent you to Tennessee. What did you have to do?
Oh man, that was an experience I never want to experience again.
Uh-oh.
I mean, it wasn't bad. I was just the only phlebotomist on the floor by myself, so I was doing everything. And I mean, I was doing the same thing that I do here in my center. I'm cross-trained. I'm also a medical screening technician and a lab tech. I process the plasma.
Okay.
So I was having to stick people back to back to back, disconnects, go do the bottles, screen. Like, I was everywhere. Like, the center really don't have no help. So, like, it was really stressful. I was working from open to close. Like, they open at 8, so we have to come in an hour early to QC everything set up and all that. So I was working like 10, 11 hours each day. I was up there for 2 weeks. So it was very, very draining. Like, very draining.
Well,
but the experience, it was really good. It was a good experience.
That's what I was going to say. Your experience with it. I mean, look at you. I mean, this is wonderful. I have one more question. How do you have the ambitions to work at the hospital?
That was my question.
I've been thinking about it, but I'm just like comfortable with where I'm at. But I have been like going home and like looking on Indeed and on websites as well. Like, I just been thinking about it. I have been thinking about it because I just feel like in a hospital, you can. It's like it won't be as bad. Like, you won't have to do as much or deal with like somebody having a heart attack or something like that. That stuff, I don't like that part.
Yeah. Okay.
How long after the class did you take the exam?
I think a month or two. because I kept studying. I wanted to make sure that I had the full knowledge in my head. I didn't go take it like right after the class was over. I think I was
I
one of the
think
last
about
ones
two
to take
months.
the test out of her class that I had.
Yeah, I think it was 2 months myself because I do remember it was around the holidays.
It was like, yeah, I took it in November, I believe.
Yeah. Well, good job,
Okay.
Brittany. Anybody else have any questions? We have some that is not that are not in the medical field, and we have some that's in the medical field. But I do appreciate you. I try to get someone different each time because everybody's experience be different. But Brittany, oh my God, I remember you like it was yesterday. It was so fun. I mean, y'all think I'm silly and fun. Brittany was, and just to know and see your seriousness is amazing. So I thank you for coming on and talking to us, and just let everybody know that even though it's been a year and you've been on your job, let them know that I still be reaching out.
Oh, I do. I be like, my teachers still be talking to me. I be like, I can text her right now.
Yeah, so even when you start work, I still kind of keep in touch. I just want to know how's everything going. But other than that, well, thank you, Brittany. Do you all have any other questions for Brittany at all? Courtney, you had some good questions.
I think I have to stop now because I have a lot.
Well, the purpose of the speaker is just to, so you all will know like what I'm telling you, and I haven't changed up. Brittany has taken my class a long time ago, and I'm still the same instructor, even better.
I think
I was just gonna
Fabiana.
say that look like you got some better stuff. Wish I was there now.
Yeah, but you didn't graduate, and you are. When you text me and said they sending me to Tennessee, I was like, what? Good job. But okay, well, I'm done with everything. Brittany, thank you for your time. I know you got off later, than expected, but I really, really, really appreciate your time. You know that I'm here if you have any questions or anything. But other than that, ladies, thank you, Brittany. I'm actually done. I'm just gonna close off with them, but thank you again.
Yes, ma'am. Y'all have a good night.
Okay.
Thank you, Brittany. Be careful.
Yes, ma'am.
Thank you.
Um, Ladies, I just wanted to let y'all know, I like the questions of what we did. Uh, if you haven't already, go ahead and finish your special collections. When you have an open, clear mind, tomorrow I will send out the final. I know tomorrow is Friday. It'll still be due at midnight. Once I collect all the grades over the weekend, then I'll let you know officially that you are a phlebotomy technician. Okay.
Okay, so I have a question with that. So the certificate that we get from you, is that only to work in Houston, right? Or
No,
how,
you're for the state of my course is Texas approved. So you will be considered a phlebotomy technician in the state of Texas.
okay. And you have to renew that too?
No, because that's just the first entity. That's just a phlebotomy technician. Once you actually become certified, that supersedes because then you're certified. So you would keep up your certification.
Oh, okay. Okay.
Mhm. Yeah, so and all those nice pictures we took and all that, I will share what I have in my phone because I will, post those later. But I just want us to finish strong. Just show me that, you can redo the special collection quiz. Do well on your final. And your final It's all 5 of the quizzes you had, just basically wrapped up into one. Questions asked in a different way. Questions, you see how the questions that we were doing on NHA, how the questions is more much of a formality. As a phlebotomist or as a CPT, the more the quizzes were getting along, I was getting more like that. So, but this last quiz, the question is in its entirety. So it is made for just like what you're gonna see later, the answer choices. So you know, just continue doing what you're doing. You still can use your notes. I just need to know that from the beginning of when we started, which was I think the 17th, till today, you can say that you have learned a lot with phlebotomy. If there are areas that you really still say, I don't know, you know, I need to know, you know, because I don't want you to go, being unsure or confused about a lot. Again, the national exam is made and set forth for you to get it tackled so you don't have to worry about it again. After that national exam, you just work on getting yourself experienced as a phlebotomist, okay? And everything else will just come as experience. Even Brittany, I mean, a lot of the medical terminology she was saying, she was brand new, like no medical experience. And it's just amazing to me. And that will be y'all as well. You know, it depends on how bad you want it. And you already proven to me that you want it because you signed up for my course. I will still continue to do my part, you know. So let's go ahead, and for those that need to redo the special collection quiz, I will text you tomorrow once I've sent out the final, and we'll get it going. I will text everybody probably most likely over the weekend when all grades is in my records and we're completely done as a group. So I can let you know that you're done. You made it through. Remember, on Tuesday, I will remind you, but on Tuesday, for those of you that can, we're going to log on from 6:30 to 7:30 to review the last 2 quizzes and possibly to go over some more practice questions together, okay? But after that, I will probably already have scheduled your one-on-one. So this weekend, I'll reach out. Remember, we don't meet this weekend because today is considered our official last day. But I will start to reach out to you over the weekend to try to schedule a one-on-one. The initial one-on-one won't be long, maybe 10, 15 minutes. That's it. It's just for us to come to an agreement, talk about your goals, for me to give you advice on how to study in an organized manner. I will send you some images to your phone. All of that stuff is set for one-on-one with me and you, okay? Any questions, ladies? I'm so sorry, we're over time. But any questions?
No, ma'am.
All right. Well, thank y'all tonight for your time and for going over. I will let you know once I've sent out the final quiz, and y'all have a good night. And also have a good weekend too. But I will text once the quiz is sent.
Good night, everybody.
Good night. Thank you.
Yes, ma'am. Thank y'all.